Hello, I am Dr. Tamara Wyse, a board-certified ophthalmologist and the founder of Wyse Eye Care and Aesthetics. I have been treating patients with fillers and Botox in addition to other neuromodulators since 2014. I started this part of my practice because I found it fascinating to learn how much these products can achieve through non-surgical means. It was ophthalmologists who first discovered that Botox could be used to treat wrinkles. The surgical background and understanding of facial anatomy needed in ophthalmology have made this a natural addition to my practice. This led me to pursue extensive additional education in injection techniques and anatomy to refine my skills as an injector. I perform all of the injections in the practice, but to complement the use of fillers and neuromodulators, our team provides a variety of additional aesthetic services. Our team is well trained in a variety of medical-grade facials, chemical peels, and diamond glow skin rejuvenation. They can also provide advice on medical-grade skincare and products. When a patient arrives for an aesthetic consult, I generally start by taking photographs and reviewing them with the patient. I want to understand each person's goals to come up with a plan tailored to the individual. The goal is always a natural appearance, a more refreshed version of you. If you look at my patients' before and after photos, you will see significant improvements in appearance, but with a natural look. This diagram gives you an overview of which parts of the face I treat with Botox and fillers. Botox is used to decrease folding and creasing of the skin and thereby soften lines. Filler replaces volume in the face that is lost with age. This volume replacement is done strategically to lift the skin and fill in creases or hollows. With age, our faces lose fat under the skin thins and becomes less elastic, and the volume of our underlying skull decreases. Fillers help counteract these effects. Fillers generally last about a year, some longer. Let's first take a look at some examples of the use of fillers. The following are patients who had filler placed under the eye in the area known as the tear trough. Filler placed in this area can smooth the transition between the eye and the cheek and improve the looks of under-eye bags dramatically. For best results, we generally treat the tear trough with filler at the same time as we treat the upper cheek. Filler lifts the under-eye skin, and this can help with the appearance of darkness under the eyes as well. The following patients had filler treatment to reduce their nasolabial folds. The nasolabial fold is the crease between the cheek and the mouth. For the most natural-looking result, we generally start by putting filler in the upper cheek to lift the cheek and provide a more youthful contour. We all lose volume in our skull bones with age, so using filler to replace cheekbone volume is key in lifting sagging tissue. By lifting the upper and outer cheekbone area first, we don't need to use nearly as much filler in the actual nasolabial fold. This provides a much more natural look compared to the result when only the nasolabial fold is treated. These next patients underwent treatment for marionette lines. Marionette lines are the folds that form at the mouth corners extending down toward the chin. Just as with the treatment of nasolabial folds, treatment of the upper cheek lifts the upper face tissue, and then less filler is needed in the lower face. A youthful face has the shape of an inverted triangle, with more volume in the upper face. As we age and tissue sags, our faces become more bottom-heavy. So once again, we prefer to treat with filler top to bottom to lift tissue, placing less filler in the lower face. Filler placed in the marionette lines provides a beautiful result and can be used to lift the outer corners of the mouth if they are sagging. The following patients underwent filler treatments to the lips. Younger patients often prefer more volume enhancement, whereas in middle age and beyond, rejuvenation is the goal. As we age, our lips lose volume, become thinner, and can take on a wrinkled appearance. While overly full lips on a more mature woman look unnatural, restoring volume that has been lost and hydrating the lips with filler to smooth wrinkles provides a natural and more youthful look. We can address asymmetry in the lips and enhance their shape as well. From a side view, we can add greater projection if it is lacking. Filler can also be used in the jawline to provide more definition and address the appearance of jowls. As in the upper cheeks, we lose volume in our jawbone with age. This, in combination with loss of skull bone volume, loss of facial fat, and loss of tissue elasticity, all contribute to sagging at the jawline. A firmer, more structural filler is placed at the back of the jawbone to pull tissue back and up, and also along the lower jawline to provide a smoother contour. The temples are another area where filler can be used to replace lost volume. While often overlooked when patients assess their own faces, hollowing of the temples over time can have a very aging overall effect. This is more common in slender women. Filler is used to restore a more youthful contour in the temple region. This is then blended into filler in the upper cheek. Combined, restoring volume in these areas helps lift the upper face. We will next review the effects of Botox and other similar muscle toxins. While fillers replace or add volume, Botox causes the targeted muscles to temporarily lose their ability to contract. Botox is used in minute doses to strategically block the nerves that control specific muscles in the face and neck. While fillers usually last about a year or more, Botox lasts for 3 to 4 months. Botox injected in the forehead will smooth lines. With an initial dose, the lines will become less pronounced. If used 3 to 4 times a year, it can gradually erase the lines, since the skin will not be able to fold and crease in that area. The glabella is the area between the brows, also called the 11s. Overaction of the muscle in this area produces a furrowed brow, often making the face look more stern or angry. These lines can be softened and gradually erased with consistent use of Botox. This provides a more refreshed, relaxed look, often a friendlier look as well. Treating the glabella also lifts the brow slightly, so when we treat the forehead, we almost always treat the glabella as well to avoid lowering the brows. The crow's feet are the lines that form at the outer corners of the eyes. These can be softened with Botox. We often don't try to eliminate them completely, as they can add warmth to a smile and make it more genuine. Making these lines less pronounced does, however, provide a more youthful appearance. The amount of Botox used, as elsewhere in the face, is tailored to the goals of the patient. When treating the crow's feet, we also treat the lateral brow. This lifts the lateral brow and widens the eyes slightly. Botox applied to the chin can dramatically reduce the dimpling and irregularity in the chin, providing a much smoother and youthful appearance.